And 2 is to be fully remote for the entire semester. This option is designed for people who will not be in Oxford. This is for people who are staying at their permanent address and not returning to Oxford, living on or off campus. And 3rd, your option is to either defer your admission or take a leave of absence. So let's dig into these a little bit more. Next slide. As a first-year student, there are 3 options. So option 1, what I said, that you'll start your classes remotely, you're at home, you stay at home, you move into your residence halls the week of September 14th, and start classes with the face-to-face designation on September 21st. Option 2, you stay home all semester, and you select a range of courses that are either online or are hybrid, and in the notes, in your registration, it notes that that hybrid class can be taken fully remotely. Or 3, you'll defer your admission for either a semester or a year. If you're a sophomore, we have our next slide. Still option 1, but 2 ways that it could look. Option 1 looks exactly like a first-year student. You begin your classes remotely, you stay at home, you move into your residence hall the week of September 14th, start your face-to-face classes on September 21st. Or, as a sophomore, you have the ability to cancel your housing contract for either the semester or the year and secure off-campus housing. In that case, you still would select option 1, and in addition, you would go through the process to request to cancel your housing contract. You would begin your classes remotely August 17th, stay at home, move into your off-campus housing the week of September 14th, and start in person September 21st. Option 2, sophomores remain at home all semester with your mix of online and hybrid classes. Option 3, you take a leave of absence. For juniors and seniors, there's one more possibility in terms of this level. So now you have 3 options within option 1. If you live in the residence halls, just like first years and sophomores, begin remotely, remain at home, move into the residence halls, start your face-to-face. Currently, if you have an on-campus housing contract, just like sophomores, you have the option to cancel that housing contract. So you would select option 1, and in addition, cancel your housing contract. You begin remotely, move to your off-campus housing week of September 14th, start face-to-face. Or the majority of juniors and seniors already have off-campus housing. You will begin your classes remotely. Ideally, you'll remain at home and move into off-campus housing the week of September 14th, although we understand that some of you will come back earlier, and then start your face-to-face classes on September 21st. Option 2 looks the same. Stay at home all semester, online and hybrid courses. Option 3, take a leave of absence. So if you select option 1, whether it was at 1A, 1B, 1C, option 1, during the first month of the term, you'll be able to have access to remote tutoring. You'll have access to telecounseling. If you are physically located in the state of Ohio, there is a licensing requirement for counselors that their license only covers people in the same state that they're in. So you could do telecounseling if you are physically located in Ohio. You could get assistance from the Miller Center for Student Disability Services, and you could participate in campus events and student organizations remotely from where you are during that first month. All of our offices are going to open with more limited service starting August 17th. So for instance, Armstrong Student Center will close at 8 p.m. instead of staying open until later on, beginning August 17th. So all offices will be open, but you may see a difference in service. All campus resources will be available starting September 14th. With option 1, you can live on or off campus in Oxford and have access to everything on campus. So I did see a bunch of questions of, let's say that I am a junior who lives off campus and I return to my off-campus apartment in August, and I want to use the rec center or I want to use Armstrong. That's fine. If you choose option 1, you have access to the limited services that will be available on campus. It just means that not all services, not all hours will be fully up and running until September 14th. But if you choose option 1 and you live in town, you can go ahead and come on campus, use our spaces, do what you need to do. Just remember that it is only sophomores, juniors, and seniors that could be released from the housing contract, and that is a separate process. So that's consideration for option 1. Option 2, you also, as a remote student, will have access to tutoring, to telecounseling, disability services, and we want you to be involved with events and orgs remotely. You are a Miami student. We want you to be connected to each other and to campus. We want you to have a vibrant campus life as much as possible, or Miami experience as much as possible remotely. So all of those things will continue in option 2. However, there are limits of what is covered in option 2, because as I want to keep reinforcing, option 2, we are assuming you are not in the city of Oxford. So Mark, if you move forward. So if you choose option 2, we are saying you are not going to be on campus. You will not have access to on-campus services. So you will not be able to use the recreation centers, Armstrong Student Center, reserve study rooms, take materials out of the library, use student health services. The BCRTA buses, and you will not be available, and you can't park on campus. You can't purchase or use a meal plan. I'll talk more about quarantine and isolation later, but those are going to be reserved for on-campus students. So if you choose option 2, and you say that you're telling us that you're remote, but you're going to live in Oxford, and someone in that house becomes ill, you will need to manage your own quarantine or isolation. We will not provide on-campus space, and you also will not be able to engage in campus employment. I also want to address the number of first-year families that have been saying on the parent Facebook page that they'll just go ahead and get an off-campus apartment for their first-year student. Know that first-year students are not being released from the 2-year housing requirement. So you can go remote for a semester for option 2, but come the spring semester, if we are not remote, which, boy, I certainly hope we won't, you will be required to move back into campus housing. So if you have signed a year lease off campus, you would not be released from paying and occupying your on-campus space this spring or as a sophomore. All right, moving forward. Option 3 is deferral or leave of absence. So if you're a first year, you could defer your admission for spring 2021 or for spring or fall 2021, and your scholarship offer will stay intact. If you're a continuing student, you can also take a leave of absence, but know that this could affect your student loans and when they need to start to be paid back. So if you have any kind of history with financial aid, you should look at the FAQs on the Healthy Together site to make an informed decision about what a leave of absence would mean, and I recommend that you talk to financial aid about your specific situation. Right, so I hope that that helped clear up your questions about what the 3 options are, what you would have access to and not have access to if you selected each option. I also want to jump in here on the idea that once you make your choice, you cannot change your choice. We used that language because we knew that as soon as you made your choice, you were going to expect us to process your refund quickly. And because there are different levels of refunds or different options, we used that irrevocable language. If you are hearing this information, or if you've made your choice and you're getting closer to August 21st and the world changes and you decide that that was not an informed decision, you should contact us as soon as possible between now and August 21st at miamioh.edu/return-to-campus. You can request that they reset your option. They'll have a conversation with you to get more information about why you want to make your change, but it is possible for you to be able to make your change, knowing that depending on timing, it may affect your account balance. That if we have already processed a refund and a different choice, then we'll have a different level of refund. You could either end up owing money because it was already refunded or get a higher refund than you thought. So that is why we used that irrevocable language. There was a reason for it around refunds, but we don't want you to feel stuck and feeling like you didn't have the information you needed to make an informed decision. Right, let's see how I'm doing on time. All right, we're going to cover academic issues very quickly because there's meatier stuff that you had questions about that I want to get to. So Mark, if you would move forward. Nope, back one, there we go. Similar FAQs, there's lots of information between what is a face-to-face, a hybrid, or an online course. The biggest confusion is a hybrid. A hybrid course is not one type of hybrid course. A hybrid course could be anything from, this is a course for 200 people, but we can't have 200 people in a space at the same time. So on Mondays, 1/3 of the class is going to be in the classroom together, and the other 2 will participate online. On Wednesday, a different 1/3 will be in the classroom. On Friday, the last 1/3 will be in the classroom. So that could be a hybrid model. A hybrid model could be that, like I am teaching a graduate course that's 3 hours. Right now, nobody wants to be in the classroom together for 3 hours, even though it's supposed to be a face-to-face course. So we may do an hour of conversation, and then I will put up information for them to go through on their own for a portion of that class. So there's a real range. So there is more information on the registration page to say whether that hybrid class can be completed remotely or whether it is one that has so many face-to-face elements that you really couldn't do that online. You can also reach out to your faculty member to get more information about that. It is up to each faculty member how they design their course and whether it is appropriate to be online or not. The first month, all face-to-face, hybrid, and online would all be using the online format. And then on September 21st, the face-to-face and hybrid would start those in-person elements. There are some exceptions for things like nursing that have clinical requirements or music performance. There are certain requirements of their major that require them to be in person. But for the most part, everything can be online, at least for a start, including labs. If you have one face-to-face class, what we can't promise is that every class is available remotely. So yes, if you were a junior or senior, you may have classes that just cannot be done remotely, and they are required classes. In that case, you need to make a decision about whether you're going to choose the face-to-face option, option 1, and come back so that you could do that and keep on track for your degree, or you need to make a decision that it is more important for you to be remote for any of a host of reasons, knowing that that may mean that you are slightly thrown off your scheduling. The important thing, I would check with your academic advisor about how those choices are going to affect your degree progress. Credit, no credit will be an option again for the fall semester for any class. Know that some classes, though, if you plan on graduate school, credit, no credit, which is just like pass-fail, but actually more friendly for the student. But graduate schools may not accept credit, no credit options, and we are not going to extend the deadline. The deadline that is published for credit, no credit will stick for the semester. Sequencing of classes and prerequisites can't change. Some classes just build on top of each other. So just like I was saying for juniors and seniors, you have to make a decision of what option are you going to choose to stay on track with your degree program. And study spaces, we will have spaces available around campus in Armstrong Student Center and King Library. We will also have classrooms open if our option 1 students want a space to be able to study on campus, or a more quiet space to be able to do their online content. So there will be those places on campus. All right. Healthy you can move forward, Mark. These are all the elements that are part of the Healthy Together website under the section Healthy You. And some of these I'll talk about in more depth than others. So physical distancing, we are all aware of physical distancing. We don't want you to socially distance, we do want you to physically distance. 6 feet apart minimum, inside or outside, is what we are telling everyone that they need to be able to do. We do have a requirement that you wear a face covering, a mask. So a mask, a bandana, a neck gaiter, any kind of a face covering is required inside every Miami building and outside where you cannot physically distance. So as you're approaching the entry to a building, or you're in a tighter place on campus where you're passing each other between classes, you do have to have a face covering. You will not be able to attend class without a face covering. You will not be able to go into a dining facility or be served in any university office without one, unless you have a medical exemption and you have approval from the North Center for Student Disability Services that you don't need to wear one. Every day we are asking every student, faculty, and staff member to wake up and do a daily symptom assessment. Take your temperature, look at a list of COVID symptoms. If you have symptoms, we ask that you stay home. Don't go to class, don't go to work. Even if you're not very ill, don't go to class, don't go to work. We have sent out a message again and again and again to faculty, even for face-to-face classes. They need to be able to accommodate students who, for a short period of time while they're ill, cannot attend class. So it may be that you stay home sick, the way you may stay home from work and do nothing at all, or it may be that you call in remotely for that class until your symptoms dissipate. So even face-to-face classes, for a session or two or a week or two, it will be possible to participate remotely, just not for the entire semester. So let's say I have COVID symptoms. I'm going to fill out a form to say I have COVID symptoms and I'm not going to class or work today. And it's going to check where you live and where you have classes. That will allow us to track not by person, but by area. So are we seeing an outbreak in a residence hall or in a classroom building or in an office that we could look for patterns early and start to do some intervention? The next thing you're going to do, I have some symptoms, I'm going to call the Student Health Center and I'm going to talk to a medical professional, and they're going to tell me whether I should come in and whether I should be tested. So that takes us into testing. I could do an hour session on testing alone. I promise you I'm not going to. We have talked about testing incessantly every week for months. This is an area where science keeps changing. So we are in regular, meaning weekly or multiple times a week, with infectious disease specialists at TriHealth, our TriHealth system. It is the largest health system in Cincinnati, and they run our student health service and the McCullough Hyde Hospital here in town. We have public health faculty that study this as their research area, with the Butler County Department of Health and the Ohio Department of Health. We are reading all of the guidelines and best practices from the CDC. The state of Ohio has its own recommendations. The issue with testing is It is most important to have testing when you are symptomatic or you were at close contact with people who are symptomatic. So people on campus, students, faculty, staff, who are symptomatic will have access to testing through student health services. TriHealth will manage that. No questions asked, you will have testing available. If you are a close contact, you will also have testing available. What we're not doing, at least at this point, is widespread asymptomatic testing. There are some schools that are saying, bring a negative test result with you. The state of Ohio, all Ohio publics, and frankly, more schools than not across the country are not doing this. All of our experts have said this brings comfort to people. It makes them feel better that we're doing testing, but it actually has no health outcome whatsoever. Because from time of exposure to developing symptoms and developing a positive test could take a full 14 days. And you can have the virus and be tested on day 5 or 6, and it will not pick up a test. So it is not at all accurate in seeing a result in asymptomatic people. And second, if you look at like Purdue, they're asking for a negative test result between August 1st and August 24th. That is such a huge range. If you have a negative test on August 2nd, it tells us nothing about what your exposure is by August 24th. So at this point, we are not doing entry testing. We are doing symptomatic testing. However, we have this core testing group of experts, and they are watching the science every week. They are running, modeling, and if it looks like there is enough testing that we could get done quickly enough that has a turnaround time that it would be useful and that would lead to positive health outcomes, we will change our protocol and do that, but we are going to listen to the science. So you're symptomatic, you get a test. You are then contacted by the Butler County Department of Health. They lead our contact tracing. Miami does not do that. The Department of Health does that. They would reach out to you and determine who were your closest contacts. So your roommates, any romantic partners, people that you were together with for more than 15 minutes in close proximity. So we were talking to fraternities. They have 40 people in a house. They may stick together in clusters of 10 for meals, the same 10 each night. That means that if somebody ends up becoming ill, it may be those 10 that need to be quarantined and tested, not all 40. So the Department of Health will work with students to figure out who their closest contacts are. They will reach out to that person, say, you have been in touch, you have been exposed to someone who either has tested positive or has a presumptive positive test, and we need you to go into quarantine. It is the Department of Health that determines quarantine or isolation, not Miami. And I read some things on this on the parents' Facebook page. The Department of Health actually does have legal ability to require someone to do quarantine. A presumptive case is not just because you have symptoms. It is a health assessment that says you have a constellation of symptoms that makes it most likely that you have COVID while we're waiting for a test. So for instance, I have had a cough for 5 years. I have a chronic cough. I cough every single day. That doesn't mean that I won't go to work because I'm afraid I have COVID. That on its own, or my allergies on their own, those symptoms, those are not going to trigger a quarantine. It is a medical decision and one that is made with the Department of Health. So quarantine and isolation. Quarantine is if you are healthy, you have no symptoms, but we know that you have had contact with someone who's ill, you go into quarantine. Isolation means that you have symptoms and you're either waiting on a test or you have been confirmed to have COVID. Two separate places. So we have spaces identified on campus. When you are quarantined, you are required to stay there for 14 days in a private bedroom with a private bathroom. Or if you have no symptoms, there are some places that we would use a residence hall that has a common bathroom, but each person would be assigned their own fixtures. So there are 4 fixtures on a floor. We would only have 4 people on the floor, each with an assigned fixture. So, so you either have to stay for 14 days, or the person that you're exposed to has to have a negative test. You cannot be tested and your test come back negative and have them say, good, you're good to go, you can leave quarantine. Because from the date of exposure, you could develop symptoms or have a positive test show up to 14 days later. So a negative test at day 5 or 6 does not tell us that you don't have COVID. This is going to be incredibly challenging, and I will tell you it is a thing that makes me worry the very, very most about coming back together, is expecting that a 19 or 20-year-old can be compliant to stay in their bedroom and bathroom for 2 weeks straight. They cannot go out for food, they cannot go out to exercise, they cannot socialize with each other because one person may have a positive and another person negative. They have to stay isolated in their space. For that reason, there are a few options if quarantine or isolation are needed. If they have a ability to go home and you have an ability to allow them to quarantine in your home, they can go home to their permanent address to quarantine or isolate. If they live off campus, our preference is for them to quarantine or isolate in their apartment and stay where they are. We have places on campus, but that is not exhaustive. We have a limited supply of quarantine and isolation, so we have to preserve as much of that as possible for our on-campus residential students, because once that is full, that is one of those areas that could trigger our ability, would have us questioning whether we could stay open for the rest of the semester. So we need to guard that quarantine and isolation space very carefully. So this is our strategy. Identify symptoms as early as possible. Get the person tested. Identify their close contacts. Move people into quarantine and isolation. Make sure that they fulfill that time. We will take care of you in quarantine or isolation. We will deliver meals. You will have medical care if you need it from TriHealth. Our Dean of Students office will check in on you whether you are ill or asymptomatic. We will make sure that you have what you need. You can participate in your classes remotely if you are well enough to be able to do that. But it is all about containment. Which brings us to the subject of mental health. We know that COVID as a whole has been difficult for all of us, and isolation makes it the more so. But for our students, the uncertainty, the disruption from what they thought that their college life would look like is all going to be key. So we're very aware of that. We do have our on-campus health center. People can participate in telecounseling, whether they're on campus or off campus, as long as they're in the state of Ohio, if that is a way that they feel more comfortable than coming in person. If they're not in Ohio, our counseling center is always available for consultation to help out-of-state students try to arrange care where they are. We also have what we call the Hope Line, and you can find information about that on our website, which is a telephone service that we provide that any student anywhere in the country could call 24 hours a day. These are not Miami counselors, but they are trained counselors that you can call, and you wouldn't schedule weekly therapy with them, but you could do one-time calls, you could do check-ins, they're there for crises, and then they update our Miami staff the next day on who they talked to and what the calls were, so that it's continuity of care. We will also have a COVID-19 support group, counseling group on campus for people who need extra support. Cleaning protocols, I'm not going to go into for the sake of time, but that's on our website. The only thing that I will add to this is everybody is going to play a part. So classrooms, common areas will all be cleaned thoroughly at least once a day, but we're not going to be able to get into every classroom between classes or a laundry room or a kitchen or a study room that somebody's using. So just like you do at the gym when you use your equipment, we're going to supply spray bottles and paper towels so that when students walk into a class, they're going to wipe down their own desk, and before they leave, they're going to wipe it down again. That this is something that we are all going to be responsible for helping keep our community health safe. All of these elements are part of our Healthy Together Community Pledge. The pledge says that I will abide by these guidelines. So hopefully I offered some clarification about who has the authority. Butler County Department of Health does. Where do you quarantine or isolate? That could be on campus or off. But all of these things, if you are going to choose option one, or if you want to be on campus for any reason, if you're going to live in Oxford, you need to sign the community pledge or you need to stay remote for the semester. Those are the two options. There is no option to be face-to-face and not sign the pledge. We are part of the reason that Ohio is in trouble and the nation's in trouble is because we are hearing from the Department of Health that people are not cooperating with contact tracing, that people are not willing to quarantine and isolate, and therefore the pandemic is continuing to spread. So we want students to be aware of what their obligations are of being able to come back and return. In terms of enforcement, both the City of Oxford and Miami will work on enforcement. So we don't want to play gotcha. We are not out to get anybody. We're never out to our students, but we certainly are not looking to put people through a conduct process for picky reasons. But the state of Ohio says no gatherings more than 10 people. We're making sure that students know that. If you have a huge party and people aren't wearing masks, you will be fined. The City of Oxford has a mask ordinance, so you could be fined $100 if you don't wear a mask. OPD will break up parties with more than 10 people. And then just like any part of the Code of Student Conduct, you are held responsible for your behavior on or off campus. So that police report would come to Miami. And if things were extreme, if they were blatant, if they were repeat, then you could be held responsible for endangering health and safety under the Miami Code of Student Conduct. So that is a possibility, but not one that we hope we have to put into effect. But I will tell you that what we hear more than anything from students is being worried that they're going to take this seriously and their peers were not. So a lot of our community on and off campus and Oxford as a whole is asking us to enforce, and we will take this very seriously. All right, Mark, go ahead forward. One more. Okay, let's see what I can get through in this last 10 minutes. I have 2 more big slides here. So let me talk about our community as a whole. I have been giving you a lot of nitty-gritty that makes it sound like we're on lockdown. I'm aware of that, and I don't want that to be the impression. I work in student life. I have worked in student affairs for 26 years. My colleagues and I, we got into this work because we love students. We love spending time with students and watching them grow, learn, and thrive. When we started this process of our planning, we talked about how are we going to make decisions. And our first decision was always about health, wellness, and safety. That is first and foremost for anything else that we do. But we said when we think about the Miami experience, what we think about is community, connection, and relationships. That is the hallmark of what makes Miami, Miami. And everything that we do has to preserve that. So we want to make sure that students and families understand the rules and expectations, but within those rules and expectations, we are still going to do everything we can to deliver a caring, relationship-based community within these guidelines, which we're all trying to figure out. In the Butler County Department of Health, we met with all fraternity and sorority presidents on Tuesday night. The number of times that they said 10 people, inside or outside, is the limit. It's very, very challenging for us to change our thinking as well of how do we do that as a campus, but we are figuring it out and we're going to make it work. Moving into the halls, that will happen the week of September 14th. We are a little stuck in terms of, we know that that is a class week, that students are in classes at that time and that they will have been in classes at that time. But we're required by the state of Ohio to have a 15-week semester. So unless we extended our term earlier and later, we have to keep all 15 weeks. We are down to the minute in every single class section. So we can't join classes to be able to have people move in that week. However, we have made sure that faculty know that that is when students are moving in and to try to be flexible. We are staggering move-in over the course of a week so that people can be physically distanced. And what we did was say, so if you have a number that ends in a 1, you move in on Monday. If you end in 2, you move in Tuesday. If you end in 3, you move in Wednesday, so that people are not in rooms next to each other, moving in at the same time, and we can physically distance. That doesn't mean that that has to be so rigid for it to still work. So when you get your move-in date, students are going to get their syllabus. They're going to look and see what they have. If you have a move-in date of Wednesday and you have a quiz on Wednesday, come back Friday instead. That's fine. Or if you have something on Thursday, your assigned date is Thursday, move in Monday. Give yourself the week to get settled in before you have that. So if you get your date and it doesn't work for you, you can move in later than that date, no questions asked. Just send us an email and let us know what day to expect you so the RA knows to look for you. If you want to move in earlier, that does require approval, but we are pretty flexible with that. It just means that you can't move in the week before. We're not ready for you. Your RAs aren't here. You're not going to have the experience that you need to have. Rosh Hashanah is also that week or that weekend. So moving in a different time to be able to celebrate the holiday, absolutely not a problem. Let us know and we'll make that adjustment. When you arrive, everyone in your party will be asked to take a symptom assessment that day and take your temperature. You're going to come to campus and you're going to see Tri-Health set up. They're going to take the temperature of every person in your party. If anybody has a temperature of 104 or higher, you will not be allowed to move into the halls that day. So save yourself a little bit of grief, take your temperature at home. If anybody in your party has a temperature or any other symptoms, stay home and move in a different day. We'll work with you and we'll make that happen. There are questions about if out-of-state students will need to quarantine before they move in. Right now, the governor, it is a recommendation that they move in, that they quarantine early. Right now, while it is a recommendation, we are not requiring quarantine upon arrival. What we are requesting is that the 2 weeks prior to you moving in, that your student and the rest of you limit your action. Do as much of a self-quarantine as possible for those 2 weeks to try to limit the possibility that you'll bring COVID with you. If the governor changes his order, that information may need to change. Life in the halls. The reason that we are offering sophomores, juniors, and seniors to be able to get out of their housing contract is it is a way to de-densify our halls, to be able to have a few less people in there. In the first few days that we have had this, we've had about 300 sophomores cancel their housing contract. So I saw somebody say, if half the students aren't in the halls, we're seeing a lot of activity of people looking for apartments, but it probably isn't as many as you think. but we will let that de-densification happen naturally. We will not move people around, because in the spring, if people want to return to the halls, we're going to do our best to be able to have them move into the same space with the same roommate that they would have been in the fall. There may be some exceptions. There are a couple of buildings that are lightly occupied. We may move those students to other spaces to be able to give us more quarantine and isolation space if we needed it. So I can't promise you that people wouldn't be moved, but that is not our plan overall. If you have a student who is coming back to the halls and their roommate is not, you have two options. You can either say, I want to keep this as a single and I want to guarantee it as a single, and you can pay the single rate for that double room and hold it as a single for the semester. Or you can say, I don't want to have that additional fee, but it means that it is possible that we could move another roommate in with your student for the semester. Life in the halls. Wow, I'm down to 5 minutes. So I want you to think on and off campus about concentric circles. This is all about risk reduction. COVID will be on campus. It will be in Oxford. There's no way that it won't be anywhere in the world right now. So what we're working on is risk reduction and containment. Risk reduction means you keep your circle as small as possible. Like I said, we don't want you to socially distance, we want you to physically distance. So you and your roommates are responsible for each other. You and your housemates are your family unit. You may not know each other, you may not always like each other. You don't always like your family either, you still look out for them, you still are responsible for them. So when you're together in your room, you're not wearing a mask. You are coming to agreement. Hopefully you are not bringing other people into that room, into your family unit, so you're keeping your unit safe. You move onto your floor, a little bit more risk. You're going to want to wear a mask in the hallway. You're not going to wear a mask in the bathroom while you're brushing your teeth, or worrying about cross-contamination while you're wearing a mask, or in the shower. There are a lot of studies that show that people naturally physically distance in restrooms. So we have decided to let that play out as it plays out, but a little bit looser on your hallway. Then you go to your building, now you're increasing your risk. You're going to wear your mask in common areas, in study rooms. We're going to limit the number of people who could be in a kitchen or a laundry room. Then you go out in the world and it's even more. So it is about educating students about how to evaluate their risk and make good choices and keep their circles small, but still have circles, still have communities, still be with your friends, just be with fewer of them, as we're all getting used to doing right now. All right, I'm done at 3 minutes. So for parents, important to say, visiting campus, we're doing everything we can to keep Oxford with Oxford. And that is why we are not doing family weekend. It's why we're not doing a fall break. It's why you go home at Thanksgiving and you stay there and finish your finals remotely. That means that we would ask you to limit the amount of time that you are coming from outside of Oxford to campus to essential visits. Please don't come back and forth more than you need to, and encourage your student to stay on campus and not go back and forth to home as much. The closer we could keep this community, the more likely it is that we can make it through this together. All right, Mark, let's jump to the next slide. So looking ahead, lots of things about really wanting Miami to promise what the future will look like, and we can't. We are in a pandemic. No one imagined that we would be where we are now. I can't promise where we'll be in a month from now. That is not about being disorganized. That's not about holding something back on you. That's not something about trying to cheat you or get something over on you. We are doing the best we can, and we are keeping health and safety in mind. The thing I am proud about of our decision, it is 100% based on health. This is a financial hit. Nothing we are doing is a financial benefit to us. This is something that we are going to live with for years to come, but we made the decision because it's the right thing to do. for students, for the faculty that are teaching them, for the staff that are caring for them, and for the community of Oxford as a whole. Even if 18 and 19-year-olds are less likely to have serious consequences from catching COVID, some of them still do. And if you think about, we also need to make sure that we stay healthy enough to be able to care for your students. We talk about, we already have a hard time getting enough people to work in our dining halls from the community. If somebody gets sick and a whole dining facility has to go down because of quarantine, we may not be able to stay open just because we're not going to have enough people to be able to feed our students on campus. So this is more than about just students. This is about our system as a whole and keeping each other safe. And we will make those decisions as we need to keep doing that. So we're not going to undo this decision. This is what we're doing moving forward. By the beginning of September, no later than Labor Day, but I'm hoping that by September 1st, we will re-examine how are national and local trends looking, how did we do the first month, what's going on in Oxford, where are we with testing, and all of those things. You asked for set numbers of what will determine our factors. It will also determine on what Butler Department of Health tells us we could do and what the governor tells us we could do. The governor could very well tell us that we're closing, and if he does, we have no choice. So we want to be open, but there are lots of factors we'll look at. If we do just make the decision to go fully online again later in the semester, we will revisit the refunds for on-campus students. We certainly would prorate the housing and dining, and people who have paid for the face-to-face option would receive an additional discount, just like the people who chose the remote option. So we will take care of that. The only thing that's out of our control is if you elect health insurance and you want out of your health insurance, that is a agreement you're entering into directly with Aetna, not with Miami. So it is up to Aetna whether they do refunds, and right now they are saying that they are not. So that would be between you, the two of you. Yes, there is a possibility that if we come back together in September, we still won't make it until Thanksgiving. It just all depends on how this pandemic plays out, and it's way too soon to say what we're thinking about for the spring. So we're at 3:02. I got through more than I thought that I would in an hour. I think I covered most of your issues and questions. If I did not, remember that we do have the call center open. You can continue to call there, especially if you have questions that are really specific to your individual circumstance. And although I'm not looking at everything on the Miami Facebook page, I am getting on as I can, and Mark is too, and we'll address things there. So thanks for sticking with me. I know I talked kind of fast, got through a lot of stuff, and thank you for your patience and your understanding, and I promise we will continue to do our best for you. Have a great day. Mark, anything to add?
Yeah, just a couple questions that I think might answer a lot of questions.
Okay.
One, do you know when they will hear their new move-in date, or approximately?
Either today or Monday.
Okay, thank you. Will parents hear if their student is quarantined or isolated, or is it up to the student to contact their parent?
It's up to the student because they're over the age of 18.
Thank you. And the one question about the pledge was about flu shots, and will they be absolutely required, or how will that be managed?
So flu shots are being required because health professionals are saying flu symptoms and COVID symptoms are so similar. We don't want to quarantine people because they have the flu. So the more flu we could avoid, the more we can avoid confusion. And you can get the flu and COVID at the same time, which I can't even imagine. So look at what our policy is for other vaccinations and how you would opt out of them. I can't remember off the top of my head what the process is, but our expectation is that you get the flu shot.
Okay, I think those are the big ones.
All right. Thank you all.
Thanks, y'all, for joining us.
Bye-bye.